Do you remember being born? Well, of course you don't, but your mother does. No matter where or how you were born, your mother probably has a pretty clear memory of the event, and hopefully it was a positive experience. Nurse midwives are some of the many different healthcare professionals who work in childbirth. They have a unique set of education, benefits, and challenges that make their care distinct and increasingly more popular. There are lots of differences between nurse midwives and other maternity healthcare professionals, such as L&Ds and OBGYNs. L&D stands for labor and delivery nurse, and OBGYN stands for obstetrics and gynecology. Some of these differences are their education and training, the challenges of their field, and the general approach they take to childbirth. Although labor and delivery nursing of all kinds work toward the same outcome, there are different methods used to achieve a safe and successful birth. Firstly, let's define a nurse midwife. Midwifery Practice and Education, Challenges and Opportunities by Deborah Walker explains the definition of a nurse midwife as well as some of their main characteristics. According to the article, midwives are designated primary care providers, and their care includes gynecology, family planning, preconception, pregnancy, childbirth, and the postpartum period. Nurse midwives are generally more focused on natural births, mostly working with low-risk pregnancies. They are trained in more holistic approaches, such as water births or home births, and their further education is less focused around new technologies, as is the education of an L&D, or OBGYN. Nurse midwives often walk with their patients throughout the entirety of their pregnancy, and they're trained in prenatal and postpartum care, as well as the actual delivery of the baby. They encourage their soon-to-be mothers to do pelvic floor exercises, such as yoga and stretching, and recommend taking natural supplements and eating foods with high protein and fiber to help prepare their bodies for birth. As with many healthcare jobs, nurse midwifery comes with its own set of benefits and challenges that impact its patients. There are many vital pros and cons to midwifery when it comes to labor and delivery. No matter the approach to a woman's pregnancy journey, the medical professionals who work with her all have the same goal: a healthy mom and a healthy baby. Some pros to midwifery are a more calm environment in general. Midwives tend to practice at the home of the patient or in a birthing clinic, which can feel more homey and less sterile than a hospital room. They also have limited people in the room, so there aren't lots of doctors and generally just the birth mother's actual family. Sometimes the mother can actually play music and create a more calm environment in general. Nurse midwives also rely more on natural body functions and less on technology, and provide a lot more prenatal and postpartum care, which can decrease the risk of postpartum depression. The results from many studies done, such as relationship between hospital-level percentage of midwife-attended births and obstetric procedure utilization by Laura Anastasio, PhD, shows how midwife-attended births are closely linked to positive birth experiences for mothers and a decreased risk of postpartum depression. There are also many challenges when it comes to working as a nurse midwife. In general, due to working with low-risk patients, nurse midwives have less technology at the ready in case of an emergency. Luckily, in working in a hospital setting, there are other professionals such as OBGYNs who can take over in the case that a C-section or other procedure is unexpectedly needed. Being a nurse midwife also comes with challenges such as burnout, long hours, and lots of stress. As a matter of fact, a health service research study done by Bree Thumman, PhD, concluded that 1/3 of all nurse midwives who took their survey were at risk for burnout due to stressful situations. All of these things can also impact the patients that a nurse midwife is caring for. As we've discussed, there are countless long-term effects on both mother and the baby that result from a delivery room experience. Recently, there has been a movement toward more holistic and natural childbirth in the United States due to its positive effects in the delivery room. As of late, midwifery has gotten a lot of good press due to studies done about its benefits, as well as the social media trend to be crunchy or more holistic and natural. From 1990 to 2003, midwife-attended births doubled from 4% to 5%, and since then they have continued to grow, and now midwife-attended births are at 12%. The view of midwives had changed from an ancient chambermaid to a highly skilled medical professional who helps women have the birth experience that's best for them. The article Factors Related to Childbirth Satisfaction by Petra Goodman includes many statistics, such as the one I just mentioned, which explain the positive effects or negative effects of the childbirth experience on the mom and baby. According to the study, more comfortable and satisfied mothers tend to be more successful in bonding with their infants. As nurse midwives are becoming more known and appreciated, they are now associated with less birthing trauma, a sense of more calm and peacefulness, as well as more positive prenatal and postpartum care. Midwifery, as in the medical field, is an area which is growing due to the cultural shift towards more personalized and holistic care. With more studies being done and more options becoming available, women are able to bring new lives into the world in the way that they feel most comfortable with. The education, training, and practicing differences between LNDs and nurse midwives affect the positive and negative aspects of the job and patient care. And due to studies, social media, and more knowledge becoming available about these childbirth pathways, nurse midwifery has grown in popularity and general appreciation. Even though you do not remember being born, it is likely that you will experience birth in some way throughout your life, whether this is as a future parent, a friend, or a relative. Being in the delivery room should be a beautiful and connecting experience, and knowing more about the professionals who make it that way will hopefully give you insight into your future as a member of the human race. Thank you. These are my notes.